Hello, I'm Dr. Abhijit Mantri. I'm practicing at Mantri Hospital next to Madhuri Bridge at Pune. And today we are going to discuss about allergic rhinitis, its management, and it will help you understand the disease better. Okay, so let's have an overview of allergic rhinitis. What does rhinitis mean? So rhinitis is inflammation of the nasal passages. This inflammation can cause various symptoms, annoying symptoms like sneezing, like itching, congestion of the nasal passage, difficult to breathe. It can cause a post-nasal drip, meaning the mucus from the nose comes down from behind into your throat and keeps irritating the throat. So few episodes of rhinitis are usually caused by respiratory infection, such as viruses or the common cold. Then allergic rhinitis is caused by allergies, and allergens are things which are present in the air around you, which enter the nose and trigger a reaction leading to an allergy. And then there could be some causes of chronic rhinitis, which means the rhinitis lingers for days together. It could be either infective or it could be allergic, or a fungal kind of allergic and fungal rhinitis. So who gets rhinitis? Allergic rhinitis, approximately 20% of the people of all ages develop allergic rhinitis, and the risk of developing is higher in people with asthma, eczema, or people who have a family history of allergy or asthma. It can begin at any age, though most of the people develop symptoms in childhood or in young adulthood. And the symptoms are often severe in children, in people in 30s and 40s. However, the severity of symptoms tend to vary in the person's life. Well, some people might have absolutely a few symptoms, and some might have severe symptoms. Okay, what are the causes of allergic rhinitis? So allergic rhinitis are caused by a reaction in the nose, wherein the body tries to react severely against particles which enter the nose. You can have similar symptoms in the eyes or similar symptoms in the throat, and in the lungs also, which is presented as asthma. Okay, so the allergic reaction results in the activation of two types of inflammatory cells in the body, called the mast cells and the basophils. These cells produce chemicals such as histamine, and so the allergic reaction is basically a histamine-mediated reaction. So you have two types of allergies. It will either be a seasonal allergy or a perennial allergy. Allergic rhinitis can be seasonal, so it happens only in certain seasons, and perennial, which can occur throughout the year. So what makes your symptoms worse? So in the outdoor allergies, the best way to prevent outdoor allergy would be trying to stay away from things you are allergic to. So maybe stay away from the pollen grains, stay away from pets or animals which you are allergic to. You can keep the doors and the windows shut. In the pollen season, use an air conditioner to cool the air, or you can use air filters to clean the air which is present. Pollen counts increase in certain seasons, so in these seasons especially you can take extra care. Then grass allergies are more prominent in mornings and evenings. So the afternoon and early evening. Ragweed is usually in the midday. So whatever you're allergic to, you have tried to avoid these things. So you can cover your mattresses with dust-proof encasings and expose them only when you sleep. You can wash your pillows and sheets and blankets regularly with hot water. So dust mite is a kind of insect which is present in the dust, and what you're allergic is to the protein of the mite. Do not use any furry or feathered pets in the home, and try to avoid keeping plants with a lot of flowers in the home. Okay. Now, other symptoms which can aggravate symptoms of allergy are those which irritate your nasal passage. So they could be either strong odors such as your perfumes, aerosols. They could be smoke arising from dust. They could be from your uh, cooking and similar. Okay, it is important to avoid smoke in all sorts and decrease the number of perfumes that you are using. What are the common symptoms? Okay, so coming to the symptoms of allergic rhinitis, the nasal symptoms are usually the blocking nose, a lot of sneezing. You get a watery kind of a nasal discharge, which is continuously. Allergic rhinitis can also be associated with ear eye symptoms such as watering of the eyes and irritation in the eyes, redness of eyes. Okay, and then the throat also gets irritated because of a post-nasal drip from the nasal secretions coming down into the throat. A lot of people with allergic rhinitis also are mouth breathers because of nasal blockage, and they tend to snore a lot. Okay, so how would you diagnose allergic rhinitis? So allergic rhinitis can be diagnosed basically from the history of the patient, and then there are some clinical signs and symptoms which lead to the diagnosis. Okay, so what is important is also trying to identify what you are allergic to. So most of the times, getting to know what triggered the allergy helps the patients to a large extent, and this can be sought by the patient himself, because the patient can recollect the events that triggered sneezing, or events that led to a lot of watering from the nose, and try to avoid things which were done just prior to the beginning of the symptoms. Now, in addition to this, we can also do certain tests. There are certain blood tests which can be done, which help you diagnose allergic rhinitis. And also there is something which is known as the skin prick test, where a number of allergens are pricked on your skin and which help you diagnose whatever you are allergic to. Avoiding the allergen will get the allergy to control in a large extent. Of course, medicines are also helpful for allergic rhinitis and can be used at the discretion of your doctor. Thank you.